Hello, welcome. I am excited to be recording this video. I have worked with you guys for a very long time, back when I was first getting started. So I'm going to try my best to do this briefly. I can talk about all of this all day long. And so let's just get started. So who am I? Very brief bio. More information is on my personal website, dralexmilspaw.com. You can also find information about me on the website of Pelvic Rehabilitation Medicine. I am currently their Director of Behavioral Health Services, and it is my honor to be working with an amazing team of physiatrists around the country. We now are in about 10 different states, and they brought me on board to their team last October 2021. And I could probably be there forever. It's really an amazing team of professionals that I'm working with there at Pelvic Rehabilitation Medicine. And so as you can see, my email is amilspaw@wellnessprm.com. And I have been in this field for almost 20 years. I've been really in the particular field of pelvic and sexual pain since I got started in my career. I started off working with Dr. Robert Eckenberg many years ago and trained with him. And then I went into private practice for about 15 years. And now I'm at Pelvic Rehabilitation Medicine. And I'm on the board of the International Pelvic Pain Society. I ran 3 years. I ran the Alliance for Pelvic Pain with Amy Stein and Deborah Cody and Dr. Robert Eckenberg and Nancy Fish. And we're hoping to bring the Alliance back soon so we can run more educational and experiential workshops for patients. So be sure to stay tuned for that. You can, if you visit my personal website, you can join my mailing list and be able to get updates on when we'll start doing those educational retreats and information and blog and information about my book and all of that. So again, that's a brief overview of who I am. If you have any questions, please feel free to reach out to me at this email. I think I've heard it all at this point, so you can't surprise me. There's nothing. Don't be afraid to ask me really just about anything in regards to your case or suggestions. And I may refer you to some of the courses that I teach at PRM, which I teach a 6-week Retrain Your Pelvic Pain course and a 4-week Reigniting Intimacy course. So I'm going to go over a few of the tips and tricks that I go into in my Reigniting Intimacy course with you today, right now. So here are all the questions that were submitted in terms of questions to ask me to answer. So you had asked how to deal with pain after intercourse. How do you decrease the IC flares after intimacy? Can a couple have sexual intercourse without aggravating the bladder? Should they abstain because of IC? What are your suggestions for helping couples with IC or painful bladder syndrome go about with as far as a healthy, non-painful, non-stressful sex life? What are some of the techniques you tell couples who cannot engage in sexual activity as often as they would like because of the IC effects? What is the correlation between STDs and painful sex and IC, and how do you have a sex life without pain or infection? So clearly I could go into all of these questions for hours, but I only have about 15 or 20 minutes for this video. So I'm going to try to keep it short and sweet, and I might not get to everything. What I will say, as far as the correlation between STDs and painful sex and IC really can vary regarding what the STD is. But I'm going to try to answer these questions really because a lot of the answers are the same in terms of anything that's going to affect the nervous system and affect increasing inflammation, whether it's an STD, whether it's irritable bowel syndrome, whether it's something you ate, whether it's stress being a big one, and pain being a big one. Anything that's going to increase inflammation and stress in the nervous system is going to increase inflammation and the brain's reaction to any incoming stimuli from the body. And so whether it's an STD, whether it's a cold, definitely we saw that with COVID. So COVID really created systemic inflammation. It actually acted a lot like Lyme in my observation, Lyme's disease. And so anything that creates a systemic alarm, right? When the alarm is going off in the nervous system, the immune system has a louder response, which is increased inflammation. And pain and inflammation tends to happen and really collect in areas of past physical trauma or physical damage, and sometimes even just emotional trauma. So if you have had a knee injury, for example, any stress that you're experiencing emotionally, mentally, or physically, as far as with a cold or any GI inflammation, that inflammation is going to go to the knee first before it goes elsewhere. And so when you have IC, the bladder is where your body is tending to store that inflammation. It's a place of the body that has been had a history of some type of pain or physical injury or trauma. Now, that could also be the location of it. And so the bladder is right next door to, if you're a female, if you have female anatomy, you have the uterus and the ovaries. So if you've had a history of painful periods, a history of cysts or endometriosis or fibroids, that's right next door, right? And so if your neighbor is playing really loud, obnoxious music, that's going to affect you, even though you're in a different house, right? So any inflammation or agitation in either the reproductive organs, so uterus or ovaries for females, the prostate for males, any agitation there can leak over to the bladder. And the biggest culprit and the main culprit of inflammation around the bladder is actually inflammation in the GI system. So chronic stress leads to a thinning of the lining of the mucosal layer in your intestines. We have 30 feet of intestines, and that creates leaky gut, sometimes as quickly as 1 to 2 weeks, let alone many years. And so to heal the bladder, we need to heal the gut. And we need to heal the gut in order to heal the brain as well. And we need to help heal the brain because any inflammation in the gut is going to create inflammation in the brain, which adds to the various structural changes in the brain that then make it difficult for the nervous system to reprogram. And so again, I could talk about this for ages, but the main piece of this is we need to heal the gut, to heal the brain, to be able to heal inflammation anywhere else, including endo, including IC, including arthritis, including fibromyalgia, including MS, including so many different things. And the lymphatic system and the liver and the spleen are all really important in how the body detoxes and gets some of the toxins out of our system, including inflammation, as well as toxins in our environment. There's a lot of toxins in the tap water. There's a lot of toxins in the air that we breathe, a lot of toxins in the food that we eat in the American diet. And so I actually just went to a whole new training yesterday by a brilliant neuroscientist all about gut health and brain health and the connection between the two, and really the snowball effect that it can have in other areas of the body. So heal the gut, heal the brain, and you're gonna heal your whole system all at once. And at the same time, certainly a big thing that I teach is how to heal from the trauma, the medical traumas, the emotional traumas, the relationship traumas that you experience when navigating something like IC, because it commonly takes so many different providers before you get an accurate diagnosis. And sometimes it's not even an accurate diagnosis, but either way, you're feeling it there. And we want to make sure we're taking care of the muscles and the nerves and everything. It's all connected. So I go into more detail, certainly in my book and in the courses that I teach. But overall, what I want you to know is that in order to manage pain during IC, during flares, and definitely after intercourse, we want to calm down inflammation before and after, and we need to calm the nervous system. To calm the nervous system, the brain needs help processing the pain, processing the worry, processing the stress, and that means bilateral stimulation. So any type of stimulation when you're stimulating the left and right hemispheres of the brain is going to be really helpful. The main two things I recommend for that are emotional freedom techniques, which is a meridian tapping method that actually also helps reprogram our genetics. It can change up to 72 different genes. So even if pain or IC or IBS or endo or anything has been generationally passed down, so you had a genetic predisposition to that, we now know that EFT can actually neutralize that, so it no longer has to come up in the future. So there's a tapping, it's called the tappingsolution.com. There's an app called the Tapping Solution, and all this is going to be, I've got a large handout that I'm going to pass out to that has all the recommended resources and different things on it for you. But overall, if you're having pain with intercourse, please don't have intercourse. Healing the body from pain and inflammation requires you to heal your trust with yourself, let alone heal your trust with your partner. And if you push through the pain, if you kind of white knuckle it, you're not only going to increase the pain and increase the inflammation, you're going to increase that all over the body, and your partner is now guilty by association. And then your body starts to recoil and not want anything, right? And I'm sure many of you have experienced that, because if A plus B equals C, so if kissing or any type of intimacy or affection leads to intercourse, which leads to pain, then the body's not going to want any of that. And the brain's not going to desire that. The brain only desires things that are rewarding. And so please do not push through the pain. We want to focus on pleasure. We want to focus on connection. And I'm going to go into that in just a moment. So with pain specifically after intercourse, sometimes heating pads and ice packs can help. But again, calming the nervous system is first and foremost. A calm nervous system is a relaxed nervous system. A relaxed nervous system calms down inflammation, calms down those muscle spasms. And hopefully all of you have a really good pelvic floor physical therapist that you're working with to really calm that down as well. Can a couple have sexual intercourse without aggravating the bladder? No. And I'm going to show you the anatomy here in just a moment. So you should abstain from penetrative sex, but that doesn't mean you can't have sex. Now, again, if arousal and orgasm hurt, because they're all included in the same muscles, the same nerves that are included with arousal and orgasm are the same ones that surround the bladder. And so sometimes arousal and orgasm can hurt. And if that's the case, then I want you to only focus on connection and pleasurable things, such as pleasurable touch, gentle, physical, compassionate touch, physical touch increases oxytocin. Increased oxytocin helps decrease inflammation and helps you and is a bonding hormone. So focus on physical touch, focus on intimacy. And again, you don't want to do anything that hurts because that's just going to elongate how long it's going to take to heal, and it's going to keep you and your partner separated, feeling that sense of disconnection. So I think the rest of this I'm going to go into in the next few slides. So let's move on to that. And first, let me show you some of the anatomy so you can get a visual here. So this app is called Complete Anatomy, and it's by 3D Medical. And it's a phenomenal app. And so this is the female body that I'm going to utilize briefly. And I want you to notice, again, it's all connected. So any headaches are going to aggravate the same nervous system that pelvic pain does, and vice versa. And there is a correlation and a connection between foot pain, pelvic pain, and cervical spine pain, like throat. The throat is very much connected to the vagina via the vagus nerve, and the feet and the pelvic floor and the throat are all next door in the sensory motor cortex of the brain. And so when there's pain in one place, it can start to spread in the brain, which then you start to have these different feelings in the other parts of the body, including TMJ, including the jaw pain. So know that relaxing the jaw and relaxing the throat calms the pelvic floor. Wiggling your toes and relaxing your toes and your feet can help calm the pelvic floor. And vagus nerve. So the vagus nerve is the nerve that bypasses the spinal cord, and it roots itself in the pelvic floor. And the way to stimulate the vagus nerve, which can calm the whole autonomic nervous system, is by having long exhalations, humming and chanting, or even gargling, or even doing what's called the Darth Vader breath, like. But that's sometimes hard for me. So I like long bumblebee breaths, or even you going through all of the different vowels actually have different healing qualities to them, to the nervous system. So the nervous system is connected, and take a look at the muscles too, right? So if you have any injuries to the knee, or any tightness in the inner thighs or the back of the thigh muscles, all of those feed into the pelvic floor here. And if the pelvic floor is tight, that's going to aggravate the bladder. And if the hamstrings are tight, that can aggravate the pudendal nerve, which surrounds the lower genital region and the saddle region, all of which can be aggravated by the pelvic floor and the bladder. And if I take some of the muscles away and add in the urogenital system here, we can see how they are neighbors, right? Including the colon and the intestines. And so if the bladder is inflamed, that's going to aggravate the uterus and any cysts or the ovaries, and vice versa. If you're on your period or if you're ovulating, that can aggravate the bladder because all of the nerves are connected. All the pelvic floor nerves go into the sacral spine and right here. And so again, if there's one grumpy neighbor, they're all going to be grumpy, and including the lower colon. So any constipation or diarrhea, all of that goes. Here's a little angle for you right there. They're all so close together. And I'm not even showing all of the connective tissue. So there's connective tissue that really helps. It's a beautiful 4-dimensional web that's all throughout the body that holds everything where it's supposed to be. And with chronic inflammation, that can become stiff and rigid and crunchy. And some people can even hear the tearing noises. And the tearing is okay, but sometimes it hurts. And we want to stay hydrated. We want to make sure we have lots of electrolytes and aminos. Again, all of that to help decrease inflammation and to keep things moving and flexible and fluid. And so you can see that if you enter into the vagina here with penetration, you are going to hit the bladder before you hit the cervix. And so, let me zoom out a little bit and get you a different view here. It's not going to let me. Okay, so again, you can't have intercourse without aggravating the vagina. Or without aggravating the bladder, because the bladder is right on top, as you can see. And so usually when people feel like they're hitting a wall, they're hitting something that really hurts, they are hitting the bladder, but they're also hitting this guy here, the obturator internus, and certainly these other muscles here. So any of these muscles that can be from tight hips, tight hamstrings, tight pelvic floor. A common muscle that is engaged with pelvic pain is the psoas muscle, which is this big boy here. It's on both sides of the spine. That sometimes feels like a stabbing feeling, but you can see how long it is and how it goes deep into the hip flexor. And sometimes people feel it under their ribs. Some people feel it in their back. Some people feel it really deep into their hips. But all of these muscles can get spasm because it's a snowball effect or a domino effect when the bladder is inflamed. And I will point out another thing about anatomy, which is important. So the nerves that can get stimulated when the bladder is engorged and inflamed is a nerve that actually wraps all the way around and goes into T12, which is also where the psoas muscle goes into T12. So if the psoas muscle is in spasm, or if you have poor posture, that's going to put pressure on these nerves that wrap around the pelvis and go into the lower abdomen. And so, poor posture and back spasms can add to bladder spasms and vice versa. So I could go into this a lot, but know that it's all connected. And so we have to relax the whole nervous system. And so afterwards, if intercourse doesn't hurt and it feels good and you're enjoying it, what you want to do is you really want to relax the pelvic floor and maybe even do some stretches, or that's a perfect time for some nice massage with some organic coconut oil, and all of that. That can be really great. You want to stretch out the lower back. You want to stretch out the inner thigh muscles, because those inner thigh muscles go right into the groin here. And you want to make sure that you really warm the body up. You don't want to do anything unless the body says, yes, please. If the body is saying, no, thank you, we have to respect that boundary, or else we're going to get into that vicious cycle again, of pain and that anticipatory pain. What you want to do is have a conversation with your partner. Esther Perel has a great free list of questions, of sex and intimacy questions, on her website. So estherperel.com. And it's, conversations for sexual health or sexuality. And it's about talking about what do we want, right? What is sex? What does sex mean? What does intimacy mean? And the 4D wheel by Gina Ogden offers a great map to talk about that and to start having that dialogue with your partner, because the connection has to come first, the connection and the trust. If that's not there, if you're not really talking about what you're expecting or anticipating, you could have different goals, different visions for what lovemaking looks like. And so mind, body, heart, spirit. Mind, what are the beliefs? What are the judgments? What are the discernments? What do you know? What don't you know? Physically, what do you want to focus on? What hurts? What parts of the body are off limits? What parts of the body feel good? Emotions. What are you emotionally feeling? Do you feel emotionally connected to your partner? Do you feel like they hear you? Do you feel seen? And spirit being that place of connection and disconnection. Again, how connected do you feel to yourself? How connected do you feel to your partner? And all of this is connected. And so if you're feeling disconnected or you're feeling afraid, the body's going to close up. The vagina is the doorway to the heart. And so if the heart is not feeling open, the vagina is not going to open. If you're not feeling safe, the vagina is not going to feel safe. And so the body doesn't lie and the body remembers. And so we have to help the body feel safe and secure every step along the way. A relaxed, safe body is a body that's ready for pleasure. Again, the vagus nerve is something that we want to stimulate and it helps retrain the nervous system, helps calm it down. It's very much connected to the pelvic nerves and how our whole autonomic nervous system operates. And so retraining the brain and retraining the vagus nerve can be really important in order to get back to having enjoyable, pleasurable sex and connection. A calm system heals faster. So we want to focus on long exhalations. Bilateral stimulation through bilateral stimulation music with headphones can stimulate the brain. Hemisync.com or Jeffrey Thompson or the emotional freedom techniques, like I mentioned already. Qigong. So this is a mindful movement, and doing this with your partner can really help increase circulation, relax the system, and have a sense of connection with your partner. So it's a gentle movement that is really great there's a lot of health benefits with Qigong, but having a shared experience that is relaxed and enjoyable and energetic can be a great way to start warming up your body and feeling connected with your partner. That's what Tantra is all about. It's about having that shared experience of connecting and focusing on that intention of intimacy. And here are some other things that can be really important. And, with simple and chaotic environment, really that's about how do you set the scene, right? If you've got the basket of laundry here or, dogs barking or a dog on the bed with you, right? There's a lot in the way. So you want to set the scene, right? Maybe what kind of lighting do you want to have? What kind of sounds do you want to have? Do you want to play some music? What time of day? Are you doing it on a time of day that's good for both you and your partner? Or are you doing it when one of you is tired or one of you is really stressed out or one of you, if you have more pain at night, that's not the time to try to have intimacy. You want to connect when the time is right and when the environment is right. So allow yourself to set the scene and have a conversation with your partner about what that scene looks like for both of you. Again, set the scene, create that safe space. So what's the difference between sex and intimacy? These are important questions that you're going to want to have a conversation about. What does intimacy mean? What actions give you that feeling? What items and materials give you this feeling? How do you show intimacy? And again, the majority of intimacy and foreplay happens outside the bedroom. All of that is accumulated in the brain and in the nervous system. And that is what leads to that sense of wanting connection, wanting pleasure, and wanting your partner to be part of that. I define intimacy as into me see, right? Do you feel seen, right? Are you allowing yourself to be seen? Is your partner feeling seen? Are they allowing themselves to be seen? I love that avatar. I see you, right? That's how they greet each other. And so again, these are questions that you want to explore with your partner. Two great TED Talks, Emily Nagoski's talk on how to sustain a strong sexual relationship. Here's the cliff notes from that. You need to feel a sense of friendship, and you need to feel like a sense of priority. When those things aren't there, it's really hard to sustain a healthy sexual relationship. So worth looking up her TED Talk. The second one that looks like I forgot to include in there is Esther Perel's TED Talk on love and desire, and she has a few different TED Talks out there. Actually, a third one I will mention is Brene Brown's Anatomy of Trust, because again, trust is so important. So hers is right on the main page of Brene Brown's website. And again, you can research or Google search Anatomy of Trust, and it's a 20-minute talk that's worth every minute. I talked about boundaries and creating that safe space, and you can draw a little, gingerbread man drawing of a body and what parts of the body are no-go, what parts of the body are maybe. We want to approach with caution and awareness and make sure we're checking in and communicating with our partner. And green means, yes, this is a part of the body that I love. I love when you touch. And we can talk about not only locations of touch, but what types of touch, right? Touch with hands, touch with lips, touch with cheek, touch with a gentle cloth or a scarf, right? What type of touch feels good, and the amount of pressure, right? Do I just want to hover? Do I want to just gently tickle? Do I want to rub? Do I want a deeper pressure, right? So Dr. Tammy Nelson talks about giving feedback in forms of kind of 1 to 5, right? I want a pressure of a 1, which might mean really just hovering around above the surface, or a pressure of 5. I really want you to really massage my feet, whatever it might be. So talk about the language that you're going to communicate with your partner on, and how do you want to receive feedback. And sometimes things like red, yellow, green, or 1 to 5 can be a way that feels comfortable and not critical or criticizing. Again, foreplay is everything. We have to move slowly, move kindly, move lovingly in order to create those new associations with rewards. If it's not relaxing, if it's not pleasurable, it's not rewarding, and the brain's not going to want to crave something or desire something that doesn't feel rewarding, doesn't feel pleasurable. Make a list for your partner and vice versa. I feel loved and cared about when you do this. I feel loved and cared about with this. But then some other things is, how do you turn yourself on and how do you turn yourself off, right? And so we tend to finger point and say, you turn me off when you do this, or you turn me on when you do this. But really the biggest sex organ is our brain. And so do we turn ourselves on by imagining that we feel loved and that they care for us and they find us attractive? Or do we turn ourselves off when we're focusing on the to-dos, when we're focusing on how they upset us last month, or when we're focusing on a fear of them judging our bodies? There's a lot of things, a lot of the noise. So go back to the 4D wheel and set those intentions about, what do you want to let go of? What do you want to release? What do you want to leave outside the bedroom? And what do you want to invite in? What do you want to make sure you focus on? What do you know about yourself as far as what relaxes you and what turns you on and what puts you in the mood? We'll end with again, a concept of mindfulness. Lori Brotto did a great job of writing this book on how to cultivate mindfulness, cultivate that place of presence, which creates a place of trust, which creates that place of desire. And certainly in my book, I go over a lot of different things as well that you'll find helpful. Again, just know that, experiential shift is necessary to heal pain, fear, and distrust, meaning you can't talk yourself out of fear. You can't talk yourself out of that trauma response. Peter Levine's audiobook called Sexual Healing is actually phenomenal. And I meant to put that in this PowerPoint and I forgot. So it's called Sexual Healing by Peter Levine. Really great. Definitely recommend both you and your partner listen to that together. And he talks you through exercises on how to help retrain and experientially retrain your system to trust your partner and trust each other again. So I hope I kept that short and sweet. I didn't actually look at the clock when I started. So I hope that helped at least a little bit, give a good overview. Again, please feel free to reach out. And I look forward to hearing from you. I wish you all love and light and quick healing.